Caring for a child is different. It's not just medicine. It's trust. It's reassurance. It's moments that families never forget. Pediatric nurses don't just treat small patients, they care for whole families. Welcome to Voices of Vital Care. Today, we are joined by a nursing instructor from Pima Medical Institute. Teri Gearon is a registered nurse, and she spent nearly a decade in pediatric nursing. And today, she's going to be speaking with us about the growing need for compassionate nurses, the heart behind this work, and how pathways like becoming a CNA, a certified nursing assistant, can be the first step toward a career in care. Teri, welcome to Voices of Vital Care. We're so glad to have you.
Hi, thank you for inviting me.
So before we dive into what pediatric nursing is all about and the path to becoming a CNA, we'd love to get to know a little bit more about who we're chatting with, what drives you, what's in your heart that got you into this career. So take me back a little bit. What was kind of the draw or the pull that brought you into your profession to begin with?
Yeah, so my grandmother, my mom's side, she's the biggest influence for me to become a nurse. So I feel like there's always something or someone in your life that will influence you to be something or do something. And so she used to stay with us weeks at a time when she was ill before she passed on. And that I was in high school at the time, and I didn't know what I was going to major in, and nursing never really came across my mind because no one in my family has a healthcare background. So I went into business, didn't like that. I went to communications, didn't like that. Decided to stop going to school for like a year, had 2 jobs. And then I was talking to a friend and he had mentioned nursing. So I'm like, wow, okay. And so I got excited, re-enrolled, and then applied for nursing school, applied for a scholarship, got the scholarship, and that's where I started my nursing journey.
Make the link for me with your grandmother, because you said she had a big influence.
Yeah, just we helped take care of her. So when she stayed with us, weeks at a time, I would help, cook for her, and sometimes she needed help, assistance with eating or bathing and all that. So it really brought me back to that where I wish I could have done more and just kind of give back.
But it also spoke to you, it sounds like, of the level of care that you would want somebody to provide with your own family member.
Yes.
And then the thought of moving forward and being able to do that maybe for others.
Yes.
So then take me into pediatrics, because that's where your career then also was for 10 years. What drew you into the pediatric field?
I just love kids. I think they're just amazing. They're so resilient. They're so tough. And they're just seeing their progress from their weakest state, their most vulnerable state, to being strong and smiling again when they're being discharged. And even the families, I mean, they're, you can sense relief from them, that weight off their shoulders from being worried about their child for days or weeks. And they all leave and they're happy together. So that's, what was the question?
What drew you into pediatrics? It certainly sounds like that's what kept you there also.
That's what kept me there, yes.
That connection to families and seeing that you are, when it comes to dealing in pediatrics, that it isn't just about your one patient, but their whole family.
Definitely.
And the need of support for that. Do you have a moment or a family that kind of sticks with you always and kind of spoke to you as like, yep, this is exactly what I wanted to do?
So let me go back to the pediatrics. I was thinking of going into geriatrics or was going to be pediatrics. And pediatrics is very hard to get into, to start as a nurse. So I figured it'd be geriatrics and for my grandma, taking care of her and, exploring more of that route. So when it comes to a family member or someone special, I would say she's the pit of me wanting to be a nurse.
And then along the way, was there a moment that you just felt that like, yep, I made the right choice?
Yes. When the moment I would say is just getting into nursing school. Like I did it on the first try. Sometimes it's hard for people, and then getting the scholarship and just being really interested in my studies. Finally, like I enjoy studying, and after changing your major a couple of times and trying to discover what you want to do with your life, I felt like it was just easy because I enjoyed it and I was excited about taking care of people.
Well, and you mentioned you had that path into business, and that was just not it. You just knew. So sometimes you know when you're on the wrong path, and you just have to find the new one.
Yes.
From what you've seen in being in, hospitals and caring for families, and being a nurse, and the compassion that takes, and you're really talking about the well-being of children and their families. What is the need like right now for more professionals in your field?
The need for particularly pediatric nurses who are skilled, it's there, it's real. And, nurses have their own skill set. We all have a specialty in something, and peds nurses have their own special skill set that requires taking care of the whole family and communicating with the patient, because pediatric ranges from infants to 17-year-olds, 364 days, learning how to communicate with a toddler who doesn't know who can't express and tell you where the pain is, and then a teenager who doesn't want to tell you, so just learning how to go around and read cues and communicate with them.
It really takes that sixth sense, if you will, to really be able to connect with them and their families. You're dealing with, I'm sure, parents who are scared, maybe more scared often visibly than the patient themselves.
Yes, absolutely.
So what is it like then, beyond the numbers, if you will, of the need? What is it like in a setting if there are not enough nurses to go around? If you're stretched thin, what is that need like? What happens?
I think there would be a decline in a certain confidence with the care that's being provided. So if a family member feels their child is not being adequately cared for like they want them to be, I feel like they would lose confidence in with that hospital or clinic or doctor's office, whatever.
How much do you connect? Because that says a lot about how much you must connect with your patients, and you are building a trust with them.
Right. You have to build a trust with your patients, because you need to build enough trust where you're letting your patient go home with their family, and you're expecting a family to take care of that child, and know how to take care of a sick child is not easy, especially for new parents. So just understanding, even their educational background, or getting an idea what's the best way for this family to care for their children. Maybe they need reading material, maybe videos, maybe just showing them and then have them teach back some of those demonstrations that you would give them. So
you're listening to Voices of Vital Care. I'm Nohelani Graff, and we're having a conversation today with registered nurse Teri Gearon, who's also an instructor at Pima Medical Institute. And we're talking about what it takes to get into the field of nursing. You're a registered nurse. You also help students looking to get into the Certified Nursing Assistant program and moving through that. If somebody is watching and listening to this today in our conversation, and they're kind of starting to feel that pull and think, this might be a path that I like, and pediatrics might be a path for me. What do you think is something that is important for them to recognize in themselves? What do you need in you to follow this for it to be a right fit?
Yeah, I think just having that compassion and the feel of the challenge. So if you like to challenge yourself, and then I feel like this is a good path to take. And then also you want to make a difference in other people's lives directly, hands-on, with being with a child, or just if they want to start in pediatrics, I think it shows that they want to make a difference in those children's lives.
You've also talked a lot about, though, that it is an emotional place to be. You're dealing with people in high emotions, some of the best times if they make their strides forward and get well, some of the toughest times. How do you hold space for both when you're in this field? And what is your advice to others to be able to balance both?
Yeah, for me, I do a lot of self-reflection. Like, I didn't know that was the terminology, and I'm in school right now, so I do that a lot, and they talk about that a lot in our, like, after an assignment, we have to do a lot of self-reflection. So I feel like that's really what I do on my drive home after a tough shift, after a good shift. What could I have done differently? How can I improve? Not knowing that I'm actually self-reflecting. So, being able to hold in these emotions is just something you have to kind of balance with. Find something that makes you happy, and then find something that gets you to think of, how can I make this better? How can I improve?
Yeah. Kind of balancing that self-care for yourself while you're caring for others as well. Talk to me a little bit about what the relationship is like also with families, because you become a big part of their journey and their healthcare journey as well. Do you get that back from them? Do they let you know how important you were in their circle and in that hospital room and in their experience?
Oh, yes. Yes. They will let you know. Most of the time it's positive, where they will just, the way they say thank you, it's just the relief or their tears in their eyes of, that you helped my child. Thank you for helping all of us. I didn't understand what was happening. You have helped explain so much and taught me so much. And just the parent who, what might have been difficult in the beginning and has softened up eventually and has learned to trust you. And they just give you a handshake and a nod, when before they would just ignore you, So there's like, you feel it. You just feel it. Just from, you sense it, that their relief and their happiness that their child is better.
Have you had those emotional moments too, or where you're like, let me take a second?
Yes, I do. I did. And with I remember I had a patient who's a baby, and she rarely had her family there because they had to work, and they had to work. I worked night shift. So they worked all the time and they couldn't be there. They had other kids at home, and they were just always so grateful that we were there, and they were always buying us snacks and donuts and, stuff like that us nurses appreciate. So I just really appreciate those moments and I miss those moments. I miss the bedside. I miss that about bedside. I miss the bond that you've developed with the families and with the patients. And it's really good feeling when you leave your shift with that every day.
Yeah, that's phenomenal. And what an impact that you have on those families. And if you're remembering those moments, they're remembering those moments for the rest of their family's lives.
Exactly. Yeah. Well. And then that could be their child's only time they're in a hospital. And now the child I remember I was in a hospital, and, there was that silly nurse who would do this, would juggle her pens or something and make me laugh. And it just makes them feel good too. And they remember that, those little moments.
Who knows if that leads them into their career path later? Sometimes it's an impact as simple as that, and going, you know what? They changed our whole trajectory.
Right.
Just with attitude.
Right.
Yeah.
Right. Yes.
Wow. So now transitioning, because you said that you miss bedside, but because now you've moved into a classroom setting at Pima Medical Institute.
Yes.
And so you're helping guide future CNAs as well through their training and through their academics. And so tell me a little bit about what you do, because you're in the lab setting. So you're really hands-on in that portion of their learning journey.
Yes. So I'm an instructor for nursing students. So it's not the CNA route, but definitely some are CNAs coming in, and we do simulation labs where we have scenarios, and we basically assess their skills and a lifelike scenario, like how would they respond? What would they do for this patient? How would they prioritize and delegate? So those are the things that we're really trying to teach them.
And at Pima, you're using and really leaning into technology to give them that hands-on training.
Yes.
So, yeah, paint a picture
fun.
for us of what it's like in a lab. You're using mannequins.
Yes. So we have high fidelity mannequins, and these high fidelity mannequins, they can, we talk through them. We change their heart rate. You can listen to their lung sounds, their bowel sounds. Some of them, if you buy the right kit, you can have amputations, all this. And so we have male mannequins, high fidelity mannequins, and we have female high fidelity mannequins that we use in our OB lab, which they give birth. We have school age mannequins where we practice with like seizures, or our babies, we practice with RSV. So when the student walks into a lab, we have the scenario already. The medications are pre-prepped. Everything, there's like a summary that they would read on the scenario. And then we ask them some little prompt questions about, what do you think this patient has? Or what do you think this patient needs? And then after they're prompted, they have little computer on wheels inside the patient rooms also. So they're scrolling along like they're looking at a patient chart. And then they review the patient's history, and then we'll give them orders. And then we kind of see like, what order are they going to go and complete the orders in the order that the orders were given? Or are they going to go straight to the orders that are priority? You know? So that's the prioritization. And we usually will have a charge nurse. They always get nervous about being a charge nurse. And so we assess their delegation. Are they delegating to the team? You know, you start the IV, you go get the medications. And so we just watch their teamwork, you know, and it's fun. It's a lot of fun. And then we'll talk for the mannequin. If they need to call a doctor, a pharmacist, or lab, where the instructors are all those people. So we just pretend, talk on the phone, and answer the questions as they're asking.
How do you help them transition? Because this all sounds very technical, and they're going down their checklist. So how do you help them balance then the personal care side? You know, you've got to go through your checklist and make sure you don't miss anything, but also provide that bedside manner, because again, you're dealing with families, you're dealing with real people.
Yes, absolutely. We're also assessing how they're talking and communicating with each other and their patient. You know, they forget that the patient is supposed to be a real patient and not just a machine laying there, you know, so they do tend to forget that a lot. And I remind them, you know, I'll talk for the patient, like, why are you talking to me? Like, you know, why are you talking about me? I'm right here. And so, and then I'll make them realize like, oh, we shouldn't say that in front of the patient, because maybe they're talking amongst each other, trying to figure out, you know, the direction that the patient is going, if they're declining. And so, just remembering just reminding them to treat their patient, with respect and care, and and asking them questions, being compassionate and saying, you know, you're okay, and we're here to help you. And a lot of students do that. So
with the role, since you've been in one position and now you oversee some, as you mentioned, some are CNAs already, what is the difference, if you will? Help clarify for us the role of a CNA versus the RN.
Yes. So the CNAs, they're with the patient a lot more. They're there to take care of their basic needs, you know, to clean them up, to take their vital signs, which are things that us nurses need to make proper assessments and make sure that the patient is, their status isn't changing in a negative way. And it helps us monitor. So they're very important when it comes to patient care.
And especially if they're there more often and sometimes asking the more daunting questions repeatedly of patients. So they, you know, have to balance that as well.
Yes.
I would imagine.
Yes. Oh, yes. They have a lot of patients. They have a lot more patients than us nurses.
What do you think would be the draw for somebody and most appealing to, I guess, maybe a personality trait or something that would draw somebody in to be a CNA and maybe stay in that career path as opposed to the other?
I would think that they want to help people. I feel like being a CNA is hard, but there's a lot of rewarding qualities about being a CNA, and they're working with talented nurses and doctors. They're working side by side. Like, their role is just as important in assisting nurses who need the help, or doctors that need assistance in the patient's room. And they're very good at supporting. Like, maybe if you treat your CNA right, they will be a big help for you as a nurse. Yeah. So,
does one have to lead to another? Do you have to become a CNA to then move on to be a nurse, or are they two different
paths? I think
paths?
It's very helpful to be a CNA, because I didn't have any, besides taking care of my grandma. Hands-on taking care of strangers is a lot different, and in their most, vulnerable state, you're having to bathe them and feed them, and being a CNA, you're doing those things. So you already got the hands-on part. And that, I feel like, is difficult for a lot of students who don't go into CNA or don't have experience like in caregiving, being a caregiver. It's hard for them to get that out of the way, the hands-on, getting used to touching people.
And certainly if you're going to go into the pediatric route and be a CNA in a pediatric unit, the hands-on is going to look quite different also, and that caregiving, because as you mentioned, the range of ages and emotions that come with that.
Oh, absolutely. Yeah. Especially with teenagers, you have to be very careful right around that age of adolescence.
So if anybody is listening and they're thinking about, maybe there's this voice inside of them that's, quietly drawing them toward wanting to care for children, wanting to, get into this path, where should that journey begin? Because sometimes it's not clear and immediate. So how do you start? What would you say should be their first step?
I would think that if you really want to take care of kids, show that you want to take care of kids. So if you need to do babysitting, if you need to get a wide range of, if you were to become a babysitter, I would sit for kids of different ages if you can. When I started as a caregiver, I became a caregiver before I applied for nursing school because I was nervous. I didn't know how to handle, the touch factor of strangers. And so when I became a caregiver, I took care of an 8-year-old, a 6-year-old, 66-year-old.
Wow.
Yeah. So it was a wide range, and they were all different family dynamics. So I would say show that you want to take care of kids in that way. Even if you're in high school, show that you're dedicated to taking care of kids. Show that you've done different things. These are the activities we've done. Because a lot of times a CNA is kind of like the distractor. If we need someone to distract the child, kind of play with them as we're doing stuff.
Okay. So that's probably something really that somebody should think about, knowing that, as opposed to if they wanted to go into geriatric, like you had mentioned before, or then that would be a kind of a defining factor. Obviously, you need a love for kids, but on a different level, on a deeper, more emotional level.
Yes. And then I feel that, if you can work with the parents also, because you really have to work with the parents.
Sure.
And if you have a CNA or a nurse or a doctor who only really plays with the child, doesn't really communicate with the parent, then that could be a problem. So you have to have good communication skills.
Yeah, because again, it's treating you're really treating the whole family.
You're really treating the whole family.
When it comes to pediatrics. Absolutely. I mean, family is always involved in in hospital care, but when it comes to pediatrics, I mean, truly.
Yes, and being sensitive to the family knows their child more than we do. So listen to them and respect when they say something and it doesn't quite sound right, but give it a chance, So just being sensitive to those things.
What would you say for you personally after, seeing what you have and working in pediatrics? What is it that has made taking the pediatric path the most meaningful to you as someone who considered maybe going a different direction and caring for our older citizens? What is it that made pediatrics most meaningful for you when you reflect back now?
It's just seeing their smiles when you've seen how much pain they were in, how sad, how sickly they were, and then seeing them when they're at discharge and they're smiling, even a little smile, or they're kind of playing, or, just seeing that progress, it just really sticks with you, and you feel really good about yourself, and you feel that you've made a difference in their lives, and that's what really sticks with me.
And that's an impact that can change someone's entire point of view and really stick with them as a fulfilling career that keeps you coming back every day when you get to have those moments.
Yes.
That's really, really special. And
it is
excellent insight, Teri. I really appreciate the conversation. And for anybody who might be considering this path as well, I think it's very insightful, for all of them. So I appreciate you sharing your experiences.
Thank you.
So pediatric nursing is certainly more than just caring for small patients. It's easing fear, as you heard. It's building trust. We've talked about that. It's helping children and families through the moments that really do matter most. So if you feel called, that feeling, it matters. The need is real. A path for you is possible. And your journey may be closer than you think. We want to say thank you again to Teri Gearon for lending us her insight. And we also want to thank you for listening to Voices of Vital Care, where purpose meets possibility. I'm Nohelani Graf on behalf of our entire team. Thanks for joining us.